Welcome to the Common Health Topics series by Vient Pharma Education. This series is designed to help healthcare professionals improve their medical English skills by exploring key health conditions. Let's learn together and enhance your medical communication skills. In today's episode, we'll be discussing myopia. We'll explore its causes, symptoms, treatment options, and patient advice to help you effectively communicate with patients about this condition. Description: myopia, also known as nearsightedness, is a common refractive error where the eye can see nearby objects clearly but has difficulty seeing objects at a distance. Myopia occurs when light entering the eye does not focus properly on the retina, instead focusing in front of it. This is usually due to the eyeball being too long or the cornea, the front surface of the eye, being too curved. Myopia often begins in adolescence and can progress into adulthood. If uncorrected, myopia can impair vision and affect the quality of life. Main symptoms: blurred distance vision. People with myopia often see distant objects such as blackboards, signs, or television screens as blurry or unclear. Squinting. To see more clearly, people with myopia often squint when looking at distant objects to focus light properly on the retina. Headaches. Straining to see distant objects can cause eye fatigue and headaches, especially after prolonged screen time or focusing on distant objects. Eye strain. People with myopia may feel eye fatigue or tension, especially after reading, working on the computer, or looking at screens for long periods. Difficulty driving. Myopia can cause difficulty driving, especially at night, in low light, or when objects are moving quickly. Causes and risk factors. Genetic factors. Myopia often has a hereditary component, with a higher risk of developing myopia if one or both parents have it. Eye strain from close work. Excessive use of the eyes for near tasks like reading, computer work, or using electronic devices for long periods can increase the risk of myopia. Lack of outdoor time. Children who spend less time outdoors are at higher risk for developing myopia, as natural light exposure plays a role in eye development. Abnormal refractive error. Abnormalities in the shape of the eyeball, cornea, or lens can cause light to focus in front of the retina. Treatment options. Eyeglasses. Wearing glasses is the most common way to correct myopia. Lenses help focus light correctly on the retina, improving distance vision. Contact lenses. Contact lenses can be an alternative to glasses, providing vision correction without the need for eyeglasses. LASIK surgery. For severe myopia, LASIK surgery can reshape the cornea to focus light properly on the retina, providing long-term vision correction. Ortho-K. This non-surgical treatment involves wearing rigid contact lenses at night to temporarily reshape the cornea and improve vision during the day. Patient advice. Take regular eye breaks. When working on a computer or reading, rest your eyes by following the 20-20-20 rule. Every 20 minutes, look at something 20 feet away for 20 seconds. To reduce eye strain, increase outdoor activities. Encourage children and adults to spend more time outdoors to get natural light exposure, which can help prevent myopia progression. Regular eye checkups. Have regular eye exams to ensure good vision control and to detect any other eye problems early. Use proper lighting when working. Ensure good lighting when working or reading to avoid excessive eye strain.
Welcome to the Common Health Topics series by Vient Pharma Education. This series is designed to help healthcare professionals improve their medical English skills by exploring key health conditions. Let's learn together and enhance your medical communication skills. In today's episode, we'll be discussing cataract. We'll explore its causes, symptoms, treatment options, and patient advice to help you effectively communicate with patients about this condition. Description. Cataracts occur when the lens inside the eye becomes cloudy, preventing light from passing through and focusing properly on the retina. This results in blurred vision, difficulty seeing clearly, especially at night or in low light conditions. Cataracts typically develop gradually with age and are a leading cause of vision loss in older adults. However, cataracts can also occur due to eye injury, underlying medical conditions, or prolonged exposure to ultraviolet UV radiation. Main symptoms: blurry vision. Patients often experience blurred or hazy vision, as if looking through a foggy or frosted glass. Difficulty seeing at night. Cataracts reduce the ability to see clearly at night, especially when driving or moving around in low light conditions. Sensitivity to light. Patients may experience discomfort or glare when looking at bright lights or sunlight. Double vision. Cataracts may occasionally cause double vision or create shadows around objects. Faded colors. Colors may appear less vibrant or take on a yellowish tint, making it difficult to distinguish between different shades. Frequent changes in glasses prescription. People with cataracts may need frequent changes in their glasses prescription, but experience little improvement in vision clarity. Causes and risk factors. Aging. Cataracts commonly develop due to the natural aging process, as the lens loses its clarity and gradually becomes cloudy over time. Eye injury. Direct trauma to the eye can damage the lens and lead to cataract formation. Prolonged UV exposure. Long-term exposure to ultraviolet UV radiation from the sun can increase the risk of cataracts. Chronic diseases. Conditions such as diabetes, high blood pressure, and chronic inflammation can increase the risk of cataracts. Long-term medication use. Long-term use of corticosteroids or certain other medications can contribute to cataract development. Treatment options. Eyeglasses or contact lenses. In the early stages, wearing glasses or contact lenses can temporarily improve vision, but they cannot stop the progression of cataracts. Lens replacement surgery. When cataracts progress and severely impact vision, lens replacement surgery is the most common treatment. The cloudy lens is removed and replaced with an artificial intraocular lens IOL. Femtosecond laser surgery, an advanced technique using laser technology to assist in removing the cloudy lens and replacing it with an artificial lens more precisely. Patient advice. Protect your eyes from UV rays. Wear UV protective sunglasses when outdoors to minimize the risk of developing cataracts. Regular eye checkups. Have regular eye exams to detect any eye problems early and adjust your treatment plan as needed. Maintain a healthy lifestyle. Eat a balanced diet, exercise regularly, and manage chronic conditions like diabetes to reduce the risk of cataracts. Limit long-term corticosteroid use. Consult your doctor for alternatives if you need to take corticosteroids for extended periods.
Welcome to the Common Health Topic Series by Pharma Education. This series is designed to help healthcare professionals improve their medical English skills by exploring key health conditions. Let's learn together and enhance your medical communication skills. In today's episode, we'll be discussing glaucoma. We'll explore its causes, symptoms, treatment options, and patient advice to help you effectively communicate with patients about this condition. Description. Glaucoma is a group of eye diseases in which increased intraocular pressure inside the eye damages the optic nerve. If left untreated, glaucoma can lead to permanent vision loss and even blindness. Glaucoma often has no early symptoms, so many people may not realize they have the disease until their vision is already damaged. There are several types of glaucoma, with open-angle glaucoma and angle-closure glaucoma being the most common. Main symptoms. Loss of peripheral vision. One of the early signs of glaucoma is the loss of peripheral vision, side vision, causing a narrowing of the field of view. Eye pain or headache in angle-closure glaucoma. Angle-closure glaucoma can cause severe eye pain and sudden headaches, often accompanied by red eyes and blurry vision. Seeing halos around lights. People with glaucoma may see halos or rainbow-colored rings around lights, especially at night. Blurred vision. Vision may become gradually blurred over time, especially as glaucoma progresses and causes further optic nerve damage. Nausea or vomiting in acute cases. In some cases of acute glaucoma, patients may experience nausea or vomiting due to the sudden increase in eye pressure. Causes and risk factors. Increased intraocular pressure. High pressure inside the eye occurs due to an imbalance between the production and drainage of fluid aqueous humor in the eye. Genetics. Glaucoma can run in families, so if a close relative has the disease, your risk of developing it is higher. Age. People over the age of 60 are at higher risk for developing glaucoma, and the risk increases with age. Chronic diseases. People with diabetes, high blood pressure, or other chronic conditions are at increased risk for glaucoma. Eye injury. Previous eye injury or eye surgery can increase the risk of developing glaucoma. Treatment options. Eye drops. Medications such as beta blockers, carbonic anhydrase inhibitors, or alpha agonists are used to reduce intraocular pressure and prevent further damage to the optic nerve. Oral medications. In some cases, doctors may prescribe oral medications to reduce aqueous humor production or improve its drainage. Laser surgery. Laser surgery can be performed to help improve the drainage of fluid in the eye, reducing intraocular pressure. Trabeculectomy surgery. If other treatments are not effective, trabeculectomy surgery can be performed to create a new channel for fluid to drain from the eye. Patient advice. Regular eye checkups. Regular eye exams are the best way to detect glaucoma early and prevent irreversible vision loss. Follow medication instructions. If prescribed eye drops or oral medications, use them as directed by your doctor to control eye pressure. Exercise regularly. Gentle exercise can help reduce eye pressure, but consult your doctor before starting any exercise program. Wear protective eyewear. When playing sports or working in hazardous environments, wear protective eyewear to prevent injuries that could increase the risk of glaucoma.
Welcome to the Common Health Topics series by AVN Pharma Education. This series is designed to help healthcare professionals improve their medical English skills by exploring key health conditions. Let's learn together and enhance your medical communication skills. In today's episode, we'll be discussing conjunctivitis. We'll explore its causes, symptoms, treatment options, and patient advice to help you effectively communicate with patients about this condition. Description. Conjunctivitis, also known as pink eye, is inflammation or infection of the conjunctiva, the thin, transparent membrane that covers the inner surface of the eyelid and the white part of the eye sclera. Conjunctivitis can be caused by bacteria, viruses, allergies, or other irritants such as chemicals or allergens. While it is often not serious and can resolve on its own within a few days to weeks, in some cases, it can spread rapidly, especially if caused by bacteria or viruses. Main symptoms: red eyes. Inflammation of the conjunctiva causes blood vessels to dilate, leading to noticeable eye redness, which is why it's commonly referred to as pink eye. Itchy or gritty feeling. Patients may experience itching, discomfort, or a gritty sensation as if there is sand in the eyes. Discharge. Depending on the cause, the eyes may produce a clear discharge from viral or allergic conjunctivitis or yellow/green pus from bacterial conjunctivitis, often causing the eyelids to stick together in the morning. Excessive tearing. Conjunctivitis can cause increased tearing in the eyes. Swollen eyelids. The eyelids may become swollen, causing a heavy feeling and difficulty opening the eyes fully. Light sensitivity. Patients may experience increased sensitivity to light, especially in cases of viral conjunctivitis. Causes and risk factors. Viral infection. This is the most common cause of conjunctivitis, often associated with cold symptoms. Viral conjunctivitis is highly contagious. Bacterial infection. Bacteria such as Staphylococcus or Streptococcus can cause conjunctivitis, typically accompanied by yellow or green pus. Allergies.
Allergic conjunctivitis is often triggered by exposure to pollen, dust, or pet dander and is characterized by intense itching and excessive tearing. Irritants. Irritants such as smoke, chemicals, or eye drops can cause conjunctivitis, but it is typically not contagious. Foreign objects, sand, dust, or other small particles in the eye can irritate the conjunctiva and lead to conjunctivitis. Treatment options. Viral conjunctivitis. There is no specific antiviral treatment for viral conjunctivitis, and it usually resolves on its own within 1 to 2 weeks. Cool compresses and artificial tears can help relieve symptoms. Bacterial conjunctivitis. Antibiotic eye drops or ointment can be prescribed to treat bacterial infections. This helps speed up recovery and prevents the infection from spreading. Allergic conjunctivitis. Antihistamine medications or allergy eye drops can help relieve symptoms. Avoiding allergens is the best way to prevent recurrence. Warm or cold compresses. Applying a warm or cold compress to the eyes can help soothe inflammation and reduce discomfort. Patient advice. Wash hands frequently. To prevent the spread of infection, wash your hands often, especially after touching your eyes. Avoid touching your eyes. Refrain from touching or rubbing your eyes to avoid worsening the infection or spreading it to others. Use separate towels. Use your own towels to wash your face and avoid sharing towels, pillows, or personal items with others to prevent spreading. Avoid wearing contact lenses. If you have conjunctivitis, avoid wearing contact lenses until your eyes have fully recovered. See an eye doctor if necessary. If symptoms do not improve after a few days, or if there is severe pain or vision changes, see an eye doctor for evaluation.
Welcome to the Common Health Topics series by AVN Pharma Education. This series is designed to help healthcare professionals improve their medical English skills by exploring key health conditions. Let's learn together and enhance your medical communication skills. In today's episode, we'll be discussing STI. We'll explore its causes, symptoms, treatment options, and patient advice to help you effectively communicate with patients about this condition. Description. A STI, also known as a hordeolum, is an infection of an oil gland meibomian or Z's gland in the eyelid, resulting in a red, painful bump similar to a pimple. STIs usually form at the edge of the eyelid, near the base of the eyelashes, and may contain pus. The condition is typically caused by the bacterium Staphylococcus and is not contagious. A STI usually heals on its own within a few days to a week without medical intervention, but it can cause discomfort and swelling. Main symptoms: red swelling. A small, red, and painful bump appears on the eyelid, typically at the edge near the eyelashes. Pain. A STI typically causes pain or discomfort in the eyelid, especially when touched or blinking. Eyelid swelling. The eyelid may swell around the STI or become swollen entirely, leading to a heavy feeling in the eye. Excessive tearing. The eye may tear more than usual and feel irritated. Sensation of a foreign object. The patient may feel as though there is grit or a foreign object in the eye, causing discomfort when blinking. Pus. The STI may contain pus, and in some cases, the pus may drain as the STI ruptures. Causes and risk factors. Bacterial infection. Staphylococcus aureus is the most common bacterium responsible for STIs. It can enter the oil glands in the eyelid and cause inflammation. Rubbing the eyes. Habitually touching or rubbing the eyes can introduce bacteria from the hands into the eye, leading to a STI. Poor eyelid hygiene. Failing to keep the eyelids clean or not removing makeup before sleep can clog the oil glands, allowing bacteria to thrive. Dermatological conditions. Skin conditions like seborrheic dermatitis or acne rosacea can increase the risk of developing a stye. History of styes. Having had a stye before increases the likelihood of recurrence. Treatment options. Warm compress. Applying a warm compress for 10 to 15 minutes, 3 to 4 times a day, can help the stye rupture and drain, reducing pain and swelling. Maintain eyelid hygiene. Clean the affected area with warm water and mild soap or saline solution to prevent the infection from spreading. Antibiotic ointment. In some cases, a doctor may prescribe an antibiotic ointment or eye drops to treat the bacterial infection. Avoid squeezing the stye. Do not try to pop or squeeze the stye, as this can spread the infection or worsen the condition. See a doctor. If the stye does not heal on its own after a few days, causes significant pain, or affects vision, a doctor may need to drain it surgically. Patient advice. Keep hands clean, wash hands frequently, and avoid touching your eyes with dirty hands to prevent bacteria from entering the eyelids. Avoid sharing personal items. Do not share towels, pillows, or makeup to prevent bacterial transmission or recurrence of styes. Thoroughly remove makeup. Cleanse the eye area thoroughly before sleeping to avoid clogging the oil glands and preventing styes. Manage skin conditions. If you have skin conditions such as seborrheic dermatitis or acne, treat them to reduce the risk of styes. Thanks for watching. Like and subscribe.
Welcome to the Common Health Topics series by AVN Pharma Education. This series is designed to help healthcare professionals improve their medical English skills by exploring key health conditions. Let's learn together and enhance your medical communication skills. In today's episode, we'll be discussing dry eye syndrome. We'll explore its causes, symptoms, treatment options, and patient advice to help you effectively communicate with patients about this condition. Description: dry eye syndrome occurs when the eyes do not produce enough tears or when the quality of tears is poor, leading to insufficient lubrication of the eye's surface. Tears are essential for keeping the eye moist, protecting against infections, and maintaining clear vision. Dry eyes can cause discomfort, irritation, and in severe cases, damage to the cornea. This condition can affect individuals of any age but is more common in older adults and those who frequently work in front of computers or in dry environments. Main symptoms: dry or gritty sensation. Patients often feel as though there is sand or a foreign object in their eyes, causing discomfort when blinking. Red eyes. The eyes may become red and irritated due to insufficient tears, especially after prolonged screen use or reading. Light sensitivity. Patients may experience increased sensitivity to light, causing discomfort when exposed to bright light or sunlight. Excessive tearing. A paradoxical reaction of dry eyes is excessive tearing as the body tries to compensate for the irritation caused by dryness. Blurred vision. Dry eyes may cause temporary blurred vision, especially after the eyes become fatigued or after blinking. Difficulty wearing contact lenses. People with dry eyes often find it uncomfortable to wear contact lenses due to a gritty or scratchy feeling. Causes and risk factors: decreased tear production, aging, autoimmune diseases like Sjogren's syndrome, or side effects of medications can reduce tear production. Poor tear quality. Tears consist of 3 layers: oil, water, and mucus. If any of these layers are deficient or of poor quality, tears evaporate quickly and fail to keep the eyes moist. Dry environment. Working in a dry, windy, or air-conditioned environment can increase the risk of dry eyes. Prolonged screen time, using computers, phones,
or watching TV for extended periods without breaks can reduce blinking frequency, leading to dry eyes. Hormonal changes. Women going through menopause or pregnancy may experience dry eyes due to hormonal changes. Treatment options. Artificial tears. Artificial tear drops or lubricating eye drops can help soothe dry eyes and keep the eye surface moist. Anti-inflammatory medication. In cases of chronic dry eyes, doctors may prescribe corticosteroid or cyclosporin eye drops to reduce inflammation and improve tear production. Tear-stimulating eye drops. Medications such as pilocarpine can be used to stimulate the natural production of tears. Warm compresses and eyelid massage. Applying warm compresses and gently massaging the eyelids can help unblock the oil glands and improve tear quality. Punctal plugs. In severe cases, doctors may insert punctal plugs to block the tear ducts, preventing tears from draining and keeping the eyes moist for longer periods. Patient advice. Take regular eye breaks. Follow the 20-20-20 rule. Every 20 minutes, look at something 20 feet away for 20 seconds when working on a computer or phone to reduce eye strain. Use a humidifier. Use a humidifier at home or in the office to keep the air moist, which helps alleviate dry eye symptoms. Avoid wind and smoke. Wear protective eyewear in windy or dry conditions, and avoid smoke-filled environments, such as cigarette smoke, to prevent dry eyes. Stay hydrated. Keeping your body hydrated by drinking enough water daily helps ensure the eyes produce enough tears. Thanks for watching. Like and subscribe to catch our next topic in the Common Health Topics series. See you soon.
ABN Pharma Education.